Hello, hello. Welcome back, technologists. Welcome back to the podcast. I am super excited for this week. Lots of things happening this week that I am so excited to tell you guys about. So, I have been trying to get back into the swing of things as far as business, podcasting, working a lot, you name it. Kids are in full swing at school. It's a little cooler this week, too. So that means that fall has finally arrived in the Midwest. So that's pretty cool because I actually like fall. I'm a summer person, but I like fall as well. Doing all the Halloween things, taking kids to the pumpkin patch and getting them those apple donuts and things like that. So that's exciting. So, a little bit of housekeeping. So, super excited for this week. I am going to be teaching my 1 hour, 60 minutes live workshop where I'm going to be talking about IV access, all the IV things to get you to be confident when you start IVs. If you need a little bit more practice, if you're brand new, doesn't matter what your experience is. So come with me 60 minutes. Make sure you guys sign up for the live workshop. Okay. I will be hosting it in my private Facebook group. So make sure you guys check the show notes, click the link, sign up so you can get on the email list so you can get access to that live workshop. There will be replays as soon as the live event is done. So make sure you guys get in on the action as far as that. As always, if you guys need help as far as courses, things like that, I have kind of revamped my website as far as where I host my courses. So I have 3 main courses. Plus, I also have an awesome coaching program that I do. It's 6 months where you come with me inside my community and my container, and I get you not only test ready in the next 90 days, but I go ahead and show you how to be the go-to CT tech and how to exceed in your CT skills. So if you're interested in that, there's an application to fill out. Make sure you guys check out the show notes for all the courses, all the things. I also do have a course that you can get for CEUs. It's through Rad CEU Providers. It's a CT 101 basics course. So if you're interested in that, need some points, check that out. Everything will be in the show notes. And always, if you want to become a guest, come on the show. You got an interesting story, send me an email or fill out the form if you want to be a guest on the CT Educator podcast. So I know I am going to start bringing on some guests. So just to kind of, mix it up a little bit. So make sure you guys check out the show notes. We've got all good details. Sign up for the live workshop so you can get on all the IV CT things. Now, let's dive into today's episode. So in today's episode, since I am teaching a live workshop when it comes to IVs, we're going to talk about IV access with confidence and how I overcame my fear when I started IVs 21 years ago. So it has been that long. Now, I know when I started learning the basics in CT, I had no knowledge on how to start IVs. Like I had no freaking clue. And I didn't even know that was even a thing. So in my home state of Nevada, we are required to be IV certified if you work in a hospital. I've always worked in a hospital. I've never worked in a clinic in my home state. Same thing when I came to Illinois. I've only worked in a hospital. I've never worked in a clinic. So hospital work is more my expertise. I've worked on the outpatient side of CT and still, we still had to be IV certified when it came to that. So I'm pretty sure in most states you have to be IV certified. So I naturally was terrified because I'm like, I have to poke the patient. Well, yeah, because we have to give them IV contrast. And on the outpatient setting, that's, 90% of our job. So my director at the time, which is a very good friend of mine, he was great. He was probably one of the few best directors I've worked with in my entire career. He says, hey, so we're going to sign up for this IV class. And another tech that worked with me because he was cross-training into CT, Jeff, who was also going to take this IV class with us. So at that time, so he says, hey, we're going to do it on this day and we're going to get IV certified. I was like, okay. So I was very skeptical because I was very scared. So the instructor that we had, she had been a nurse at the hospital I worked at. She was a nurse for 30 years. So she worked in all aspects of nursing. So she did ER, she did pediatrics, she did ICU, not only in pediatrics, but adult. She did critical care. So she was a jack of all trades when it came to nursing. I will never forget this lady. Her name was Mary Jo Russo. I will never forget that name as long as I am a CT tech, even when I retire. So she was instructing this class, and of course, you have my director, you have my coworker Jeff, and myself, who are the techs. Everybody else are nurses. Okay. And everybody else needs, they already knew how to start IVs except for the three of us, right? Well, Matt kind of knew, but Matt had to get recertified because Matt had been an X-ray tech for 25 plus years. So anyway, I go up to stick the dummy arm and I said, okay, first of all, I've never started an IV. I don't even know where to start. So I need help from A to Z. She says, okay. So she tells me exactly how I'm supposed to, I'm supposed to have bevel up and make sure that I clean off the area, putting on the tourniquet and all those things that we have to do when we start IV access. So then naturally I had to practice on real life patients. So she would give me the hardest patients to start IVs on. I mean, we're talking patients on chemo, dialysis, patient who have rolling veins, small veins. And I remember getting so upset every time I would miss. And I'm thinking to myself, why the fuck is she giving me all these patients like this? Like, does she want me to fail? I mean, because that's what I thought. So finally, one day, it was patient after patient after patient. And I think we had to get like 20 sticks, if I remember. It could be a lot different in every institution or state that you live in. So I think it was 20 sticks we had to do. So finally, one day I said, Mary Jo, I said, do you hate me? She says, no, why? And I said, because you give me all these difficult patients. I can't get a flash whatsoever on this IV access. And I don't think I'm going to get this. And I'm ready to quit because I keep failing. She took one hard look at me and said, I'm going to tell you why I'm giving you all the hard patients. And I sat there and I looked at her and she says, because that's going to make you a good tech. And you're going to be a pro. And if you can stick a chemo patient, you can stick anybody. And it'll make the easy sticks a breeze. So that kind of sat with me that day. And so then the next patient, of course, that I had, patient's been on dialysis for the last, 15, 16 years. And I go, oh, great, here we go. Had to do a PE study on this patient, right? And so I went ahead and did it and said, okay, I hope for the best. First stick, flash, boom, 20 gauge, AC. And after that, I just kind of kept rolling. And so she says, see, I told you were good. And I said, I just thought you kept giving me these patients because you disliked me. She goes, no. She goes, I knew it from day one that you came to my IV class that you would be good. So that's why I pushed you to be good. And it's those types of people that you collaborate with that are always, you will always remember, and you always want to have them in your corner. Okay. After that experience, I became a pro at IVs. Like I was not afraid to miss some because sometimes we just miss some patients and sometimes patients are difficult, and that is true. So, but I looked at it as a learning experience and I always asked for help. So if I got, 2 sticks and I got nothing, I would bring in one of our RNs and say, hey, I stuck the patient twice. I can't get anything. And sometimes if the RN couldn't get anything, then of course we would have to call the IV team to come in with the ultrasound and have them go ahead and place the IV. So, what I'm going to suggest is I'm going to give you some tips in this episode when you're learning IVs. And these are some of the things that if you come to my live workshop, I will be showing you. So, number one, do not be afraid. Yes, we all are afraid of sticking the patient and missing, but that is part of the job. So, you can't go in because patients can feel how you're feeling. They can see the fear and they can feel it. So if you go in there with confidence and just say, okay, I'm going to do this. And it doesn't matter if you miss, at least if you go in and you show that, hey, you're confident, you're going to do this and you're going to do your job. That's all that matters. Okay. Because yes, it's overwhelming if you're starting an IV for the very first time. It is overwhelming because you've never done it before. But like I said, patients can feel when you're anxious, they can feel when you're scared. You don't want to do that because then that puts the fear into them. I mean, they're already coming for a test, whatever kind of diagnosis that they're trying to rule out, especially cancer patients, like they already have enough to deal with. They don't need you to be afraid as well. Okay. So you get 2 attempts. That's the next tip. 2 attempts. If those 2 attempts fail, make sure you get an RN to help you or the IV team to help you, whatever the protocol is at your facility. Another thing, please do not stick the patient more than once or twice, excuse me. Do not stick the patient more than twice. Yes, practice makes perfect, but I've seen technologists over the years that will stick somebody 4, 5, 6 times. Do not do that. 2 attempts. That is what you get. And I think that is standard practice anywhere you go. 2 attempts. And then after that, call a nurse, call the IV team to place that IV for you. Okay. And the more that you get comfortable, the more you practice, it will just come like second nature. Okay. Because there are going to be IVs that you're not going to be able to get. And that's okay. Some patients are just difficult. Some patients have no veins. They've had treatments and dialysis and a lot of times we have intravenous drug users that are recovering addicts. So there's a lot of things that go into play, especially when you attempt to place an IV in the patient. And we all know when patients come into the emergency room, nurses have the same issue too. When they come in and you have somebody who has no veins, I mean, they encounter the same thing. So we as professionals make sure that, hey, we don't stick the patient more than once. We give it our best try. And if it doesn't work, we have resources to help us. Okay. So I hope these tips were very, very helpful in this episode. And like I said, all these tips that I gave you in this episode, I will be teaching live in my workshop. So make sure you sign up for the workshop. Link is in the show notes so you can get in on the action and become an IV pro and have confidence when you start IVs on your patients. Okay. So if you're interested in becoming a guest on the show, make sure you fill out the form in the show notes. If you have any questions or you have an interesting story, please send me an email. Email is in the show notes. So at contact@thecteducator.com. So make sure you guys check in all the action, okay? As always, if this episode was very helpful, make sure you share it with somebody that you know, because I always love to provide good educational content for you guys. So thank you so much for joining me in this episode, and I will chat with you guys next week.